about 2 weeks ago, the conference organized by Harvard University on the science of Tai Chi and Qigong has been really exciting and quite amazing. I feel very happy to be able to present. I did 2 presentations, one with Professor Song, the other one mostly by myself. And I'm going to talk a little bit about that my presentation. But before that, I want to just tell you how much importance this conference is. The fact that Harvard has organized such a conference just means that Tai Chi has so much evidence, so much interest around the world that they feel it's sort of mainstream enough for them to put their name on it. And the fact that it's so well attended, so many people there, I was just impressed with almost anyone I know, which I know a lot of people doing research to do with Tai Chi, teaching Tai Chi and so on, are there. And I met them. And then when I was there for the 2 days, just about everywhere I go, including going to the toilets, there are people who say hello to me that I know a lot of things, but a lot more I don't know, but they knew about our program and they either get benefits or teaching it, see the benefits. I just have this very strong feeling that the Tai Chi for health is well recognized, well respected, and the Tai Chi itself and the Qigong are just something that's so important for the modern time. There's no time in history that Tai Chi is more needed. I think our world's in a mess, and it's really good to have Tai Chi to bring us more calm, more harmony, and better inner resilience, inner health. So that was a great conference, and I'm so happy that Professor Song is going to be here to talk to you about her presentation, and Kay is going to represent a number of our people who attended the conference, their view, what they take from that. So today I'm going to mainly talk about my presentation, the worldwide accreditation. I mainly want to talk about why we should have accreditation, 2, what it is about, and 3, how we did it, and then what I hope the future will be. As we all know, this conference are very scientific basis, and there are a lot of presentation on scientific findings, but most of these findings has no doubt show Tai Chi and Qigong has immense health benefit to the mind, the body, improve immunity. It's something that the world really needs. However, if you have the best evidence and if you show how wonderful it is, and if people don't like it, if we don't have an effective and safe way to teach, then not many people are going to learn it. So the accreditation, that is to show people that these are the group who got accredited because they fulfill such requirements. So you can be sure that anybody who's accredited from the Tai Chi for Health Institute are safe and effective instructor. Then I think that would be a very, very important key to bring Tai Chi and Qigong to even more people. In fact, we have worked on that for 24 years, and we certainly have reached millions and millions of people because people do trust our instructors are safe and effective. So it's really important to have such accreditation so people know they are going to a safe place. Safe and effective can mean so much more than what some people think. For example, if you're teaching is too difficult, or you teach a very long Tai Chi form, people might find that, oh, they're not good enough. They might find that, hey, it's just too hard to learn. And people can be put off. And if they can be put off, uh, then you lost the person. And also they will tell everybody Tai Chi is too hard. It's not going to work for me. So that is a form of emotional safety, because if we can encourage people to feel that, hey, you're good, you can learn this, and it's easy and it's enjoyable, then people will feel, hey, I'm efficacious, I'm fine, and they will enjoy it more, and they spread the news out. So the way we teach and what we teach has a lot to do with safe. Emotional safe can be so many layers, so many things. If you teach like what our institute do, we teach in the learner orientated um, way, so that we actually don't use the word student. That seems to be like talking down to people. We use the word participants that join us to share this wonderful news. And our whole total teaching construction is based on having an emotionally interactive, friendly environment so people can grow. So those are the things that safety is involved. But having said that, too, the physical part, the Tai Chi and Qigong, some of them have high risk movements, high risk practice in some way. So a safe instructor should be able to know what are the high risks and to be able to teach it so that it is safe, and sort of giving people adaptation so they don't have to take the high risk movement. And also they should be able to teach people with different conditions, knowing how to adapt a Tai Chi program for almost anybody can do Tai Chi. As well as that, a lot of people don't know they have a condition. People might not know they have a heart condition or diabetes. Half the people who have diabetes don't know they have it. So a safe instructor need to know how to take care of them, teach it in a way that is safe for them. And if something happened to them, the instructor need to know what to do. So these are the kind of safeties that is a lot more than what you think. Uh, Effective too can be so far-reaching. If Tai Chi is too hard and difficult, no one learned it, then you're not effective. If it's too expensive, hardly anybody can afford it. It's not effective. So effective means that your Tai Chi form should be really, of course, best to be proven by scientific study how effective it is. But still, if no one come to it, it's not effective. So effective means that it's got to be easy, but it's got to be interesting. Teach it in a way that stimulate interest and make people want to practice. And so I can go on about that. All those I think are really, really important of how we can spread Tai Chi to more people. And if we have a set of tests, we have ways to train people right, just like the Tai Chi for Health Institute, which is a non-profit educational body. And it has establish a curriculum, establish a multi-tier system to train instructors of all different levels, and it establish ways to test. So people have a really well-prepared preparation before they come to the workshop. They have paced themselves, learn all those necessary material. And when they come to the interactive workshop, there's interaction. So the trainer can know whether the participants has achieved certain level that they can be safe, effective instructor in terms of technique, and so how safe they are, their understanding. So there's interaction, there's quiz, and there's some discussion and role play presentation. So people need to show and the master trainer that actually fulfill those criteria before they get certified by our institute. So this started 24 years ago. Since then, we've been well. The first certification, I work with Arthritis Foundation, and since then we've been working with organizations around the world. For example, the National Council on Aging in USA, the USA Administration for Community Living, and so on. We work with many health departments around the world, Arthritis Foundation around the world, to refine and improve our certification process. So our training is very practical, and it's sort of easy, but you have to fulfill all those criteria that I mentioned before to be our instructor. And we learn a lot from the working with big organizations, national organizations. We also set up systems. We have composed a lot of teaching materials in terms of video, books, and CDs. So we have this complete system. We learn a lot over 24 years. And the fact that we have millions of people learning Tai Chi from our instructors is a confirmation of that we're able to train safe and effective instructors. And I just think in the future, more organizations would do that. I hope that if a government body were to take up accreditation, they need to really understand what Tai Chi is, understand what is safety, how effective, and how to do it practically. You know, it doesn't matter if you ask a doctor to teach Tai Chi, he or she does not necessarily make good Tai Chi teacher just because he knows a lot about medicine. It has to be specific for Tai Chi programs. And that's why it can be reasonably easy. Anyone can learn, but it has to learn the right things. Knowing anatomy of the whole body does not necessarily help you to be a better instructor. And so I hope if there's a government body to set up accreditation, they should consult and study carefully to get the practical criteria, not making it a barrier. Or organization like us who really dedicated and have a lot of dedicated people to contribute, then like we already did, we spread this reputation, and we can grow, and we willing to share with other organizations to make Tai Chi to more people. Now, one thing in the conference before I go, I want to say I was so happy to know the VA department in USA, as you know, is a huge department, and they have over the recent years has adapted complementary medical practice as part of healing process for their veterinarians. And Dr. Janet Clark, who's in charge of that department on working with complementary medicine, they have looked into what makes safe, effective instructors. They look into outcomes and their training. And in the list of people they accept, the training, the certified instructor, they accept Tai Chi for Health Institute was the top of the list. So I was really happy to know that we have people who study carefully, I mean, government organization, and found that we really did met that criteria. And as I say, the Institute is always there. My special invited speaker, we're very fortunate to have Professor Rhayun Song again to talk. And she presented Tai Chi for memory and his research study on it. And if you haven't met Professor Song yet, she's a professor from Chongnam National University and the Dean of the Nursing Faculty. She's also the director of the Research Center for Tai Chi for Health. She has really interested in research on Tai Chi for Health, and I think she published more papers than anybody else I know. She really knows the topic well, and she will be talking to you about her research study very soon. I'd like you to put your hand together and welcome Professor Song.
Hi everyone. It is so honored to meet everybody who is so much our wow. The number is great. Actually, as Dr. Len emphasized so far, we were so impressed to see how many people gathered on that conference. I heard that was the close to 300, and it's not easy to see that many people to focus on one specific intervention, which was Tai Chi and Qigong at this time. We've been practicing, well, some of you, as like a Patricia, I know you for more than 20 years, and you've been practicing Tai Chi all that years. And well, at the beginning, we wouldn't imagine that then many people come together to the conference practicing Tai Chi and also providing the scientific evidence underlying it. Well, for the talk, for my presentation today, I want you to think that there is a perspective for research, perspective for practitioner, and that conference was like a meeting point from that perspective, from research and from practitioner. I heard you're gonna have a small talk discussion opportunity later in this forum, and I want everybody to think about, okay, I'm practitioner or I'm researcher, but how we can combine those perspectives together. I think that would be very good point for discussion, because what we are doing as a researcher is to validate the intervention, to provide how it works, and what is the effect, what is the underlying mechanism, that kind of things. But it doesn't exist if we don't think about the practitioner's perspective. So it's always better to combine those perspectives to see that. As a practitioner or as an instructor, you are using the evidence. That is the scientific intervention. So we are always thinking about how it works and how we're going to teach it safely, as Dr. Lam emphasized. So when you have that knowledge on how it works, about that intervention you are providing to the participants, that's going to be very strong, convincing the talk to people, convincing enough to motivate them to keep on, so that until the moment that they're going to feel those effects themselves. That's a very important point. Today, my presentation is just one piece of it. I'm talking about on cognitive function. And I've been applying Tai Chi to so many various health conditions, and cognition is only one part of it. But whenever we are doing, whoever we are doing Tai Chi together, we are looking at how it works and how we're going to do it safely, so that the product by research about those underlying mechanisms, we can share with the participants and motivate them enough to keep on their practice. So that is the beginning and the final point that we always keep in mind. Okay, so I'm gonna share the slide for today's talk. This is the presentation that I did at the Boston, the TCHI Whole Health Conference. The title of the conference was actually very interesting because they used the whole health, that concept. Whole health itself, it's like a promise that we are not looking at the people only for their cognitive function, only for their cardiovascular function, something like that. It's not working. Through Tai Chi and Qigong, we are always thinking about it's not only body, it's mind and body. And as a whole person, we have to try using this scientific intervention. We are gonna make a whole health promotion, like a health promotion for whole health perspective. That was the point. So we're gonna abandon any piece from those piece by piece approach. We always the pursuing the whole health perspective through Tai Chi and Qigong. And actually that's what we've been doing. Next, please. I'm gonna shorten my presentation for any the long background, but I'm gonna say about cognitive decline and then TCQ as a mind-body intervention. There are so many types of Tai Chi, so many types of Qigong we've been applying for cognitive function. But I was looking at the safety monitoring too, because that's always the safety first whenever we apply TCQ to those people with some special health conditions. And then clinical implications will be followed. Next, please. As you know, and then you're gonna, I believe whenever you teach some classes, you're gonna see a lot of people, they have some level of cognitive decline because so many aging, all the adults would be there. So that's kind of natural process we have to encompass. So older adults experience age-related decline. Well, we all know that. And then those physical cognitive function will be declining too. So how we're gonna come up with some scientific evidence to improve actually their physical and cognitive function? That is the focus. And as you know, Tai Chi Qigong has been introduced as a traditional mind-body exercise, and it's been showing those scientific effects that actually it works to improve their physical and cognitive function. One of my previous study was looking at, okay, how it works to improve cognitive function. Is it directly on cognitive function or only through physical function, like indirect effects, something like that? That was the interesting topic. And then at the end, we found that, yes, Tai Chi can improve physical function, and then through physical function, we can improve cognitive function. But when we removing all the physical function, also Tai Chi can directly improve cognitive function. That was the conclusion. So I know that with the scientific evidence, I can tell people that while you are keep practicing Tai Chi and Qigong, your physical function will be improved, and also your cognitive function will be improved directly and indirectly. So that's how we can say that. For this presentation, it's about meta-analysis. I'm gonna just introduce meta-analysis for you very briefly to show at the end the combined effects of TCQ on cognitive function. Next, please. This is how it works. There are several intervention studies, experimental studies to show how TCQ works for cognitive function, cognition. People actually has an idea about if we do physical activity, if we do any types of aerobic exercise, can we improve cognition? That was starting in 1970s. So at the time, the series of studies keep showing that yes, cognitive function can be improved through physical activity participation. So they are, if those kind of intervention studies keep accumulated, then if it has enough studies, then we do move on to meta-analysis. Meta-analysis is not one single intervention study. It's actually the combined, those cumulated study, we all combined those data and then do the analysis to show the combined effects of that particular intervention, whether that's really effective or not. So that if you see any result, any research result from meta-analysis, it means that you have enough scientific evidence to show the combined effects. So that's what we actually happen here. It means that there are enough scientific evidence it's coming up to show strong enough evidence to show the effects of the types of exercise on cognitive function. Task-specific physical activity, that's another intervention. Well, it become more specific and specific like that. So it's gonna lead cognitive benefits. These days, there are a lot of studies that using Tai Chi or using dual task. It's like you are doing Tai Chi, you are doing something else. You are walking exercise, that's aerobic exercise, right? So you are walking, but you have another, like you ask you to 100 minus 7, keep on minus 7, something like that. So you have to the calculating those activities while you are doing walking exercise. In that way, you come up together, and then those task-specific physical activity can improve cognitive function. So after that, people look at exploring other modes of physical exercise. And finally, 2010, Dr. Cheng come up with, yes, I think there is a potential effects of Tai Chi on cognition. So it's new. For Tai Chi, we are looking at those effects, and that's very new, but it start to have like a series of studies. And then I was able to do the meta-analysis on Tai Chi only this time. Next, please. So Tai Chi as an exercise alternative, well, actually it started like this, but now we have enough evidence to show. Next. This is like a bubble chart, and it shows the evidence map. Evidence map of Tai Chi, it shows how many population, the Tai Chi have been applying to so many populations with various disease conditions. And also it shows the larger bubble, smaller bubble. So if there is a study a lot, then it becomes larger and larger. And if you look at that, there is a no effect evidence, or it's unclear evidence, or potential evidence. That's how they show. And cognitive function, it's right here on the right side. It shows clearly that cognitive function, TCQ, has a potential effects on cognitive function. Next. So I'll briefly show the randomized clinical trial design, experimental design with the strongest design format. And they were exploring the effects of Tai Chi on cognitive function, 328 older adults with diabetes and mild cognitive impairments. And that was the RCT, it's a randomized trial. And Yang style simplified Tai Chi was applied, and outcome measure cognitive function. Next. Yes, so as you can see, more and more various populations Tai Chi has been applied to, and then we begin to see the cognitive function improved. Next. This is another study by Yu, and it also explored Tai Chi on cognitive function. This time, it was the aged older population, more than 50 years, with mild cognitive impairment. Also, it was randomized trial using Yang style for 6 months. Next. As you can see, the Tai Chi, various types of Tai Chi has been applied. It was sometimes, it was good thing to see sometimes Sun style, sometimes Yang style, or Chen style. There are so many styles of Tai Chi has been applied, also leading to the similar effects on cognitive function. Next. Yes, this is another study by Zhu, 41 older adults with Parkinson's disease this time. And also they were looking at the cognitive function. As you can keep on seeing, MoCA, it's Montreal Cognitive Assessment Scale. It's one of the very standardized, internationally famous scale. And if the studies keep using the similar scales, we can compare those effects. Next. Yes, this is another point that we were looking at. How long do we have to do the intervention to see the effects on cognitive function? And 6 months was actually very, the most studies, they were using 6 months. Interestingly, they were using 6 months, sometimes shorter, like 12 weeks. Still, we were able to see the significant result. Next. Solianic also explored Tai Chi on cognitive function, and this time it was during COVID-19 pandemic, randomized trial. And as you can see, Tai Chi, it was very short form. Well, COVID pandemic, you cannot ask people to keep on to the class. So they were using 8 forms Tai Chi for only 10 weeks. Still be able to see the effects on cognitive function. Next. Yes, that was the duration of the intervention we are looking at. This is like one thing that I was disappointed actually. Among 20 studies that I found, all RCT, randomized studies with strong design, and then on cognitive function, only one study reported there is a adverse event or not, and only 28%, only 7 studies reported safety monitoring. So still, the safety monitoring is very important, but it's still, most studies, they don't look at those safety monitoring. And that's one thing that as a researcher, we need to keep on looking at, and then be aware that we need to report those parts. For anybody who is doing the experimental research using Tai Chi on, it's not only Tai Chi, using any intervention on the outcome with those population with the special health conditions, we always have to report about those. We are using some kind of monitoring system, and then also whether or not there was a adverse event there reported by the participants. Next. So we have enough studies, 27 studies. So we were looking at, okay, what is the combined effects of those 27 studies? Do we have enough evidence to say that the Tai Chi is effective on cognitive function? Next. This is how we do the meta-analysis. It looks complicated, but the most important thing is the end, the overall effects, because we are combining those 27 effects to see that whether those combined effects are giving us enough evidence that the effects of cognitive function on effects of Tai Chi on cognitive function. As you can see, the effects is 0.5. This is moderating level. It's not like a small effect size. It's a moderate size of effect size. So we can say that yes, TCQ is very much effective to improve cognitive function. There is a LL, there is a UL. It's like a confidence interval between lower limit and upper limit. If there is no zero between that, as you can see, 0.33, 0.66, there is no zero between those range. It means that it was significant. So we can safely say that there is a moderate size of effect of the TCQ on cognitive function, and that moderate size was significant. Next. Okay, we were looking at whether shorter duration and longer duration also lead the same significant effects. As you can see, when you are doing the long term, which means that longer than 12 weeks, it's gonna be also, as you can see, it just has the 0.55 moderate effects. Well, actually, the longer term, 0.5, and if you look at the shorter term, it's 0.3. So we can see clearly if you are applying Tai Chi to the population shorter than 12 weeks, it leads to the smaller effect size. If you do that longer than 12 weeks, it leads to the moderate size, the larger effect size, right? And both of them were significant. So regardless of the duration of intervention, it always leads to the significant effects. But if you do that longer, then you're gonna lead to larger effect size relatively. Next. By doing meta-analysis, accumulating those combined effects, we can see that TCQ was effective in improving cognitive function. This, although the 70% didn't say anything about adverse effects, actually there was no adverse effects for those studies who reported either adverse effects or safety monitoring. They said that there was no adverse effects reported by the participants. As a scientist, they are looking at underlying mechanism of TCQ. That's why we were talking about, is it improving cognitive function directly or indirectly? What is the underlying mechanism about that? That was the scientific evidence keep coming on. As I told you at the conference, there was a whole bunch of researchers only looking at those research, how it works, what is the underlying mechanism. And then also there's pretty much of the population there participating at the conference, they were practitioners. So they are doing the practice, they are teaching the practice, and at the same time, they were curious how it works and what is the scientific evidence about what they are doing, right? So we can, I think those perspectives, those informations, they are both very much important point that we can meet together, those perspectives who are meeting together at the conference. We have to think from both perspectives to come up with strong scientific evidence for TCQ, what we are doing. Thank you very much.
Thank you so much. Thank you, Rhayun, Dr. Song. I always enjoy so much when you can make the research so understandable to those of us who are not in that world. Thank you. And I think your point about perspective and that we need to understand the researcher's perspective as well and how important the uniformity is. And that's one of the real benefits to the programs that Dr. Lam has designed, that we're uniform. We're trained the same way as teachers, And we teach it the same way in our classes, and that makes it more suitable for being able to say with confidence, we know this works, and this is shown in studies. And thank you so much. Cognition, it is so important part of health, and more attention is being put on it now. We appreciate that. We were fortunate to have some master trainers and senior trainers from the Tai Chi for Health Institute able to be observing participants at the Harvard Symposium. And they have gotten together and shared their takeaway points and insights. And we are very lucky and welcoming to have our master trainer from the Albany, New York area, Dr. Kate McKee, who is a licensed psychologist, now retired, but she is going to represent the feedback and discussions from our trainers who were able to also be there and observe as practitioners. Kate, Dr. Kate.
I usually, when I'm doing Tai Chi, I don't usually use doctor. I usually just stick with Kate. I would put myself very definitely in the category of practitioner rather than researcher when it comes to Tai Chi. And I think the thing that was most impressive to us collectively as practitioners at that conference was the degree to which Tai Chi is accepted by mainstream, prestigious, respected researchers. We were, I think, all a little bit surprised to realize the degree of interest of some of these very, very well-respected biomedical research entities. Harvard Medical School, Massachusetts General Hospital, the U.S. National Institutes of Health, Beth Israel Hospital, Hong Kong Metropolitan University, UCLA, University of Sydney, Faculty of Medicine and Health, Tufts University. I mean, these are all among the most respected of research entities, all of whom were at the conference, were happy to present at the conference, and all of whom are actively trying to explore how Tai Chi works. Which brings me to the second point, I think, that we were all very impressed by. By and large, the research community has moved beyond, is Tai Chi good for your health? I think it's largely accepted that yes, it is in a whole myriad of ways. The research community is now looking at a more granular level to try to understand what are the mechanisms by which those benefits occur. What are the conditions under which the specifics of the benefit happen? For example, how long does a program have to be in order to benefit cognitive function? Is 6 weeks enough? Is 12 weeks enough? The research community has moved on to these more, I think, detailed kind of questions and has simply accepted the evidence that, yes, Tai Chi is beneficial. And one of the ways that became so apparent to us, if you simply look at the topics that were presented at the plenary sessions, the larger sessions, the researchers who presented these topics were clearly already persuaded by the evidence that there are these benefits. And I just wanted to very briefly mention some of the topics in which the plenary sessions focused. No surprise to any of us that there's a recognition that Tai Chi improves balance and gait in older adults. As Dr. Song has already talked, we know that Tai Chi, with meta-analysis, demonstrates benefit on cognitive function, including memory, attention, executive function, stress reduction, mood improvement. But we also know, in addition, and these are just the benefits that were discussed at the plenary session. So this is, I'm not trying to do an overall, here's what the research says. This is just what the folks at the Harvard conference focused on. They talked about the benefits of practicing Tai Chi in reducing some forms of chronic pain. They talked about the benefits of Tai Chi in treating depression in geriatric patients. There was discussion of improving the immune response to vaccines with Tai Chi and this one got my attention, and reversing age-related inflammation in older adults. Yeah, that one definitely got attention. Tai Chi being useful in treatment of patients with cancer, and not just improving their mood, but literally improving their physical function. Benefits of Tai Chi in the treatment of rheumatological conditions, including RA and fibromyalgia. And finally, the benefits of Tai Chi in the treatment of complex heart and lung patients with multiple morbidities. Every one of those kinds of topics was discussed by researchers who started from the position that there is a body of evidence indicating the benefits of Tai Chi in each of those areas. So I think, in summary, for those of us who were there as practitioners, Tai Chi has come of age in mainstream biomedical research and is well recognized for a multitude of health benefits. There were a couple of areas that were, we thought, particularly interesting to us as practitioners. One area which I'm just going to mention briefly, but to help to signal to all of us, this is an area where we thought people were going to want to pay attention over the next few years. And that's the whole area of research around the function and the role of fascia in controlling and coordinating muscle tissue and underlying other tissues in human physiology and function. Dr. Eline Langevin of the National Institutes of Health did a plenary session on that, which I would be foolish to even begin to think that I could summarize for you. But what's clear is this is a cutting area of research that it appears is going to have a lot of impact and a lot of value to us in trying to teach mind-body activity like Tai Chi. The last study that we wanted to mention, and then I'm going to ask my colleagues if they had anything they wanted to add, because I shouldn't be the only one talking. There was one particular study that really got our attention. It was done by Dr. Andrew Ahn of Harvard Medical School. And what Dr. Ahn did was, in some ways, intuitively obvious. He used radioactive tracer dyes in one study, and in another study, fluorescent dyes. He injected in beagles acupuncture points, and then looked at the imaging that resulted to see where did that dye go and what did it look like. And what he reported was, it looked like exactly what traditional Chinese medicine would predict. The dye first forms a star-shaped small dot, for lack of a better word, and then makes a linear shape in the direction and position of the meridian that traditional Chinese medicine would predict, at a consistent rate of about 2.5 centimeters per minute. The thing about this is, they also did some research to try to determine, some additional studies to determine, does blood flow explain that pattern, that imaging? Does lymphatic flow explain that? And they concluded they didn't think it did. They ended their presentation by saying what seemed to explain this best of all was traditional Chinese medicine. And clearly there's an area that needs additional research. I think, to conclude, and I'm looking at the clock and thinking we're going to be out of time. What I would say to everyone, and I think my colleagues would agree with me, if Harvard puts this conference together again at some point in the future, I'm definitely going. And those of you who are there, I suspect you'll be there as well. So thank you very much. That's the practitioner's view of 2 days. In 6 minutes, I think I did it. Thank you.